I am Dr. Sarah Mitchell, and today we are going to talk about a serious lung condition called chronic obstructive pulmonary disease, also known as COPD. Many people think long-term coughing or breathing difficulty is simply a normal part of aging or smoking, but persistent respiratory symptoms should never be ignored. COPD is a progressive lung disease that can make breathing increasingly difficult over time and seriously affect quality of life. In this video, we will discuss what COPD is, common symptoms, causes and risk factors, difference between COPD and asthma, complications, diagnosis and treatment, lifestyle management, and common myths about COPD. So let's begin. What is COPD? COPD is a chronic lung disease that causes airflow blockage and breathing problems. The condition usually develops gradually over many years. COPD mainly includes chronic bronchitis, emphysema. Many patients may have features of both conditions. What happens inside the lungs? In COPD, airways become inflamed and narrowed. Lung tissue becomes damaged. Air gets trapped inside the lungs. This makes it harder to breathe normally. Over time, even simple activities may become exhausting. Common symptoms of COPD. Shortness of breath, one of the most common symptoms. Breathing difficulty often worsens during walking, climbing stairs, physical activity. Chronic cough. Many people develop a cough lasting months or years. Excess mucus production. Patients may cough up mucus frequently. Wheezing, a whistling sound may occur while breathing. Fatigue, reduced oxygen levels and breathing effort may cause exhaustion. Chest tightness. Some people feel pressure or discomfort in the chest. Main causes of COPD. Smoking. Smoking is the leading cause of COPD. Long-term smoking damages airways, lung tissue, air sacs inside the lungs. Even passive smoking can increase risk. Air pollution. Exposure to polluted air and toxic fumes may contribute to lung damage. Workplace exposure, dust, chemicals, and industrial fumes may increase COPD risk. Genetic factors. Rare genetic conditions may also affect lung health. Difference between COPD and asthma. Although both affect breathing, they are different conditions. Asthma often starts younger, symptoms may come and go. Airways are more reversible with treatment. COPD usually develops later, symptoms gradually worsen, lung damage is often long-term. Some people may have features of both conditions. How is COPD diagnosed? Doctors may recommend medical history review, lung function tests, spirometry, chest X-rays or CT scans. Oxygen level testing, early diagnosis helps slow disease progression. Treatment options. Inhalers, help. Open airways, reduce inflammation, improve breathing. Oxygen therapy. Some patients with low oxygen levels may need oxygen support. Medications. Doctors may prescribe medicines to reduce symptoms, prevent flare-ups, treat infections if present. Pulmonary rehabilitation. Special programs help improve breathing techniques, physical endurance, quality of life. COPD flare-ups. Symptoms may suddenly worsen due to infections, pollution, smoking, weather changes. Flare-ups may cause severe breathing difficulty, increased coughing, more mucus production. Severe flare-ups may require hospitalization. Complications of COPD. Untreated COPD can lead to severe breathing problems, frequent lung infections, heart strain, reduced oxygen supply, reduced physical activity. In advanced cases, daily life may become difficult. Lifestyle changes for COPD. Quit smoking. This is the most important step. Stopping smoking can slow lung damage significantly. Healthy nutrition. Good nutrition supports energy levels, muscle strength, immune health, muscle stress, stay physically active. Light exercise improves endurance, breathing efficiency, overall health. Vaccinations, flu and pneumonia vaccines help reduce infection risk. Avoid air pollutants, limit exposure to smoke, dust, chemical fumes, weedies, emotional impact of COPD. Living with breathing difficulty can affect mental health, confidence, social life, independence. Some patients experience anxiety, depression, fear during breathing episodes. Support and counseling may help. Common myths about COPD. Myth: only smokers get COPD. Reality: non-smokers can also develop COPD due to pollution or other exposures. Myth: breathing problems are just normal aging. Reality: persistent symptoms should always be evaluated medically. Myth: there is no treatment for COPD. Reality: treatment can greatly improve symptoms and quality of life. When should you see a doctor? Consult a doctor if you experience chronic cough, persistent shortness of breath, wheezing, excess mucus production, reduced physical stamina. Early treatment can slow disease progression. Final message: COPD is a serious but manageable condition. Recognizing symptoms early, quitting smoking, following treatment, and making healthy lifestyle changes can greatly improve quality of life and breathing function. Your lungs work continuously every moment of your life. Protect them before damage becomes severe. Note closing. If you found this video helpful, stay informed, prioritize lung health, and encourage awareness about chronic respiratory diseases. Thank you for W.